السلام عليكم. هلو ماماز، حياكم الله في بودكاست رضاعة ولافندر، الحلقة رقم 11. Hello mamas, it's the second half of our interview with Dr. Jack Newman. It's been my pleasure and I'll leave you with the rest of the interview. Enjoy. I'd like to hear from you about tongue ties and lip ties.
Okay. You see, the people will say, okay, like we never saw tongue ties before. How come there's so many tongue ties now? And then the answer to that, of course, is that we, 50 years ago, hardly any mothers were breastfeeding. So the whole question of tongue tie doesn't matter. Now we see that, first of all, we have 90% initiation rate of breastfeeding. So now we're seeing the problems that are due to tongue tie. And there are a number of issues that come around the tongue tie. First of all, most health professionals have never learned what a tongue tie is, and that it can cause problems. What problems does a tongue tie cause? Well, first of all, and most importantly, is pain. So if a mother has pain, somebody should be checking the baby's tongue and see if there's a tongue tie. It's not so difficult, but it is. You need to know how to do it. And so if the mother is in pain and the baby has a tongue tie, you take a scissors and you go snip, and it's done and it's over, and there's no need to do it to make a big deal out of it. And we have lots of evidence now that tongue tie does interfere with breastfeeding, does cause mothers, the baby to have a poor latch. I mean, a tongue tie means a poor latch. So mothers have pain, babies don't get milk properly, and even if things go well, and we do see mothers who are, say, 3 weeks after birth, the baby has a very tight tongue tie. They have no pain, the mothers, and the baby is gaining weight well. But the problem is that when a baby has a poor latch, and if baby does have a poor latch when they have a tongue tie, then 2 or 3 months down the road, all of a sudden the milk starts to dry up. And that's because of the poor latch. So we have this dilemma. What do we do if we see a mother who was sent, well, your baby has a tongue tie, and we do get this, but the baby's 2 weeks old, the baby's obviously drinking milk very well, and the mother's not in pain. What do we do about this? Basically, well, sometimes, if it's very tight, we will release it. If it's one of the borderline tongue ties, we'll say, okay, you're not in pain. The baby is doing well with breastfeeding. Here's the thing to watch for, that the milk supply may be decreasing, okay? If you see that some of these signs, like the baby pulling at the breast, the baby sucking his fingers a lot, say at 3 or 4 months, then come back and we can release the tongue tie then.
So releasing does not happen at the time we see it at the beginning, but when she has problems. No. Why not we clip it at the beginning and that's it?
Well, sometimes we do. Sometimes we do it at the beginning. Sometimes the mothers don't want it. Say, well, I mean, it's fine with me as long as it's not going to cause any problems. But we don't always know if it is going to cause problems.
Right.
But the majority of our patients are having difficulties. Mostly, I mean, the most common thing we see is sore nipples. Sometimes in combination with the baby not getting enough. Sometimes babies are not latching on. But if there are problems and the baby's got a tongue tie, we'll recommend releasing the tongue tie.
And how about lip ties?
That's a more difficult one because we don't know. There's no good proof that lip ties cause problems for breastfeeding. The dentists think it's a big problem because it causes a gap between the front teeth. But that's just a cosmetic problem, really. And some people like their gap between the teeth. Like Madonna is apparently very happy to have a gap between her teeth.
Right.
I don't know. But from the point of view of breastfeeding, I don't know. We do see some mothers where we think that the baby's lip tie does make a difference. But really, from a scientific point of view, nobody's ever proved that it caused problems with breastfeeding. But there are some times when we think, yes, definitely this baby needs to have the lip ties released as well.
Right. Thank you. And is there any relationship between them? Like, are they occurring together, or they're separate, and you can have either, or how does it work?
No, I think if the baby has a lip tie, then the baby also has a tongue tie. But if the baby has a tongue tie, he doesn't necessarily have a lip tie.
Okay, so a lip tie is a good indicator that the baby might have a tongue tie?
Yep. And I think one of the most important things about tongue ties is you can't just look and see, oh, well, that looks like a tongue tie or not. I think you have to put your fingers on either side of the frenulum and try to lift. And if the tongue doesn't lift, then that baby's tongue tie is significant, because you can't always tell by just looking. Sometimes I have a photo on our website. If you go to our website and you go to tongue tie, there's a photo of a baby who has no frenulum. You can't see a frenulum. But when he's crying, as in the photo we took, his tongue really has a very significant heart shape.
Okay. So it can be like it's not assessed by looking.
No, it's not good enough just to look. And this is why so many babies we see, the parents have been told there's no tongue tie, because they just look and they say, oh, well, it looks all right.
Right. And how about running an index under the tongue? Does it work? Like to see if there's a bump, or it doesn't work?
Yeah, that helps. Sure. That helps. I think we do both. I mean, I do both.
Okay.
I run my finger underneath. Is it tight or isn't it? Let's see if we can lift the tongue. It's hard to lift. Okay, then this is significant.
Okay. You mentioned babies falling off the chart, or like growing well at the first 2-3 months and then not growing well enough.
No, that's they don't necessarily fall off the chart. They just act differently. So some babies, true, they fall off the chart, and they're obviously not gaining weight as well as they should. So, but some of the babies actually continue to gain weight fairly well, and so it's not so much the weight gain that becomes the issue. It becomes the behavior of the baby. So typically at 3 or 4 months, if this has been going on for a while, what happens is that the baby will spend very little time on the breast. He'll pull away very quickly. Sometimes he'll pull away without letting go, so the mother starts to have nipple pain again. Sometimes when they come off the breast, they seem happy, but that's because they're sucking their fingers much of the time. And sometimes they'll actually refuse to breastfeed altogether, at least during the day. They will breastfeed at night pretty well, and that is fairly typical of this late onset decreased milk supply, that the babies feed well at night, but sometimes will refuse to feed at all during the day. That becomes, obviously, there's a problem here. And so that's when a lot of the mothers show up at our clinic, because the baby's refusing to feed during the day. But I think that the problem has been going on for a long time. So if the baby's 3 or 4 months old when they come to us, I think it's been going on for several weeks, maybe even longer. And the usual cause that we see is either the baby has a tongue tie, and the other major cause is that the mother is feeding the baby on only one breast at a feeding. Now, this is very common, this one-sided feeding. And if I get 40 emails in a day, I would say at least 10, maybe even more, mothers are feeding the baby on one side only. And what puzzles me is that some of these mothers are feeding the baby on one side only, but then supplementing with formula instead of giving both breasts. And I mean, I still don't understand that. I know that the reason that the mothers have been told to feed on only one breast is that the baby will get the high-fat milk at the end of the feeding. But the problem is that they're not taught how to know that the baby's actually drinking milk from the breast. There's this idea among even lactation consultants, at least some of them, that if the baby is on the breast and sucking, he must be getting milk. And that's that's clearly not true. So we say to the mothers, finish one side, and before the baby gets too sleepy, take him off and offer the other side. If the baby's not hungry, he won't take it. If he is hungry, then he will take it. And otherwise, we end up with mothers whose babies are not gaining weight, or at least they're not happy at the breast anymore. And we really need to get this message across that one-sided feeding makes no sense. In fact, some mothers are told to do something called block feeding. You've heard of this?
Yes, I heard of it.
Yeah. Not only do they feed on just one breast at a feeding, they feed several times on the same breast before switching on to the other side. So there may be 4 or 5 feedings on just one breast, and then then do they switch to the other breast. And the problem with that, of course, is that you get a very rapid decrease in milk supply with an approach like that.
Hello?
By the way, sorry, yes, but you don't hear me anymore?
It was a bit far.
Oh, moving closer. Okay. So yes, the milk supply will decrease if the mother is feeding 3-4 feedings on the same breast. And this is done for what they call oversupply. But the thing is that I don't believe in the oversupply.
You don't believe in oversupply?
Nope.
Okay.
I think that the diagnosis of oversupply comes from, the baby chokes when he's on the breast. The milk is so fast that he chokes while he's on the breast. But the thing is about that is that if the baby can't handle the flow, then the problem is the latch. Again, not too much milk, but a poor latch. And I'll bet you that 90% of those babies have tongue ties too, that they can't handle the flow.
Wow, that's very insightful. Thank you.
Oh, anytime.
Can you tell us about more causes of low supply?
Well, I think that it would be wrong to say that every mother can produce all the milk the baby needs. That's clearly not true. But the vast majority of mothers who are having difficulty producing all the milk they need, that's because they've gotten off to a poor start with breastfeeding. So there are some things that definitely prevent mothers from producing enough milk. So we have some mothers. I don't know how common this is in Kuwait, but we have mothers who have had breast reduction surgery, and these mothers usually cannot produce all the milk the baby needs. We have had a few mothers that did very well with breastfeeding, even though they had breast reduction. We even had a few years ago, we had a mother who breastfed twins exclusively for 6 months after breast reduction. So, it doesn't mean that they won't produce enough milk. But I would say that clearly the vast majority of mothers who have had breast reduction don't produce enough milk, but they can still breastfeed. And, we use a lactation aid to supplement the babies at the breast if it's necessary. Some mothers with hormonal problems don't produce all the milk the baby needs. Some of these mothers have smallish breasts too, but it's difficult to know if the breast is good enough, if you wish, to produce all the milk that the baby needs. So there are some hormonal, and a mother's had a piece of retained placenta might not produce all the milk the baby needs. So if they're still bleeding significantly after a few weeks and they've come to us, we usually ask them to get an ultrasound to make sure they don't have a piece of placenta that has been retained. But the vast majority of mothers, yes, I think they could produce enough milk if only they were given good advice. And there's some mothers we just don't know. I mean, they haven't had any surgery on the breast. Their breasts look normal. They don't look like what people say, that's insufficient glandular tissue. We just don't know why they're having problems. But as I say, they can still breastfeed.
Okay, thank you. And how about I ask you 2 more questions? I know it's been, you have given us a lot of your time. Thank you so much. And I want to ask you about pumping. Thank you. Pumping.
About which?
Pumping. Expressing milk.
Yes, 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 yes. Well, I'll tell you what I really think about it. um, yes, well, most of the time, women should not have to pump their milk. I think it's hard work, it's unnecessary, but it's an important piece here is decent maternity leave. And okay, Kuwait is a rich country. How much maternity leave do you get?
We get sometimes we get 70 days if she's in a private sector, and if she's in a public sector, she might get 3 months, and sometimes she can extend it to 6 months.
Okay, so in Canada, mothers can take 18 months. And I think that makes it a whole different situation, no? In other words, they never have to pump the milk. They never have to give bottles. They never have to give formula. I mean, assuming that the breastfeeding is going well. And so I think that, a rich country like Kuwait can certainly can mandate, laws can be passed. That's how it happened in Canada. They passed laws that said you have to have this much maternity leave. And, it works. I mean, it's not for everybody. We have people who are not so well off here. And, it's hard for them on the small amount of maternity leave money that they get to stay at home. But for the majority of mothers in a relationship where the husband is making a decent wage anyway, they can stay home, and they can stay home for 18 months, and their job is guaranteed once they go back. Once they're ready to go back, they can't be fired for taking maternity leave. And this is something I think that would be very good in all countries of the world. Kuwait can afford it.
Well,
so that's the main
I'll
reason.
say inshallah.
And I think it's that's the main reason that women express their milk or pump their milk. I don't know. I think that giving babies bottles is, if it's not necessary, it should be avoided. I guess for some very sick babies in hospital or very premature babies, yeah, it's something that may have to be done. But even with that, we don't start premature babies early enough with breastfeeding. In the Scandinavia, babies are starting to go to the breast at 27, 28 weeks gestation, so that they could go to the breast. They could breastfeed if they had the opportunity.
That's amazing. And I think women are going to benefit a lot from all that you have shared with us. And I know that women in Kuwait are we're very beautiful. And beauty is very important. Thank you. So Botox and filling and like things, cosmetics are always a concern for women in our society.
I see. So, I mean, I am not a big fan of that sort of thing like Botox because I don't know if you had noticed that people that get Botox they don't seem to have any expression. No, maybe
Right.
it's just my imagination.
Right. No, it's right.
It's not. Yes. Okay. So the problem is that if you want to have Botox, that's fine. You can still breastfeed. The thing is that the Botox stays where it's injected, right?
Mm-hmm.
Otherwise, it doesn't work. So it stays where it's injected. And for a drug of any sort to get into the milk, it has to get into the blood. If it's not in the blood, it can't get into the milk. So Botox doesn't get into the blood, right? Right. So there's no concern if the mother wants to have the Botox, if she wants to have some sort of surgery on the face or anything like that. Again, local anesthetic doesn't get into your blood, and so it's safe. In fact, almost all medications are safe during breastfeeding. It's one of my pet peeves. I think I told you that it's one of the most common emails I get is about medication.
Right. Tell us about the medications that are not compatible with breastfeeding.
There are very few. Most of them are anti-cancer drugs, because anti-cancer drugs, we call them, poisons with beneficial effects, but they are very toxic. And so even a little bit, especially if it's prolonged medication, then it can cause problems for the baby. But that's, if we eliminate the anti-cancer drugs, there are actually very, very few drugs that require mother to stop breastfeeding.
That's very encouraging.
Yep. One of the most common ones I get questions for is for antibiotics. I cannot think of an antibiotic that requires a mother to stop breastfeeding.
How about antidepressants?
Same. The amount that gets into, I don't want to go into unless you want me to, I don't want to go into a lesson in pharmacology, but what are antidepressants for? They are to treat depression. Where does the depression come from? From the brain. So, a drug like, Prozac, okay? A drug like Prozac, in order to work, it has to be in the brain. Well, if it's in the brain, it's not in the blood. Okay, there is some in the blood, but very, very little compared to what's in the brain. So if it's in the brain, can't get into the blood, can't get into the blood, can't get into the milk.
I'm so thankful. Thank you so much for your time, for your information that you have shared with us. I'm really honored of this. I always tell my friends that I have this dream to come to Toronto and have some clinical practice at your clinic. And I feel that I got a bit of chance to more hope for me to do this, inshallah, in the future. It's such an honor.
Okay.
Thank you so much.
It's not far. Come. It's only about 12 hours by fly?
It's I don't know. I think it's something like this.
Yeah, it's far. But if you're here,
we fly through the North Pole and then we go to Canada. We don't fly I went
the ocean.
Yes.
Yeah. Well, it feels like the North Pole right here today.
We are waiting to have you here in Kuwait as well, and maybe we can get more of this knowledge and support that you're giving us.
Okay, that
Thank
sounds
you so
good.
much.
I'm looking forward to it. Okay, great. Thank you.